Varicose veins can kill you. What if I told you that just because you don't have visible signs of varicose veins, that doesn't mean that you don't have a vein problem? And what if I told you that women start out with weaker vein walls than men, and that hormone changes like pregnancy and menopause can further weaken their veins? I guess you'd be just as surprised as I was. My guest today literally saved my life back in 2022 by discovering that I had a previously undetected blood clot in one leg and a sparkling brand new blood clot in the other. Now, couple that with the discovery of poorly functioning valves in both legs. Oh, but wait, I also had superficial phlebitis. I was a bit of a hot mess, but I'm better now. And I think you will be too after you hear from him. So, please join me in welcoming my friend and my favorite cardiovascular surgeon, Dr. Gregorio de los Rios de Frias, to the show. Dr. G, thanks so much for joining me today.
Thank you, Sarah, for having me.
What I'd like for you to do is, will you explain to my listeners what is venous insufficiency?
All right. It's basically when the valves of the vein don't close properly, that produces a lot of venous hypertension, like when you have high blood pressure, but in the venous system. So that makes the bulges that you see in the legs of the people. We usually have little spider veins and then they progress to big veins. And that's very dangerous because that venous hypertension can produce a condition in the valve flow and in the venous flow that's called turbulence. And turbulence produces, in the long run, leg ulcers and blood clots.
Is venous insufficiency genetic, or can it be controlled by diet or exercise? Is it just something that some people are going to get, as I talked about with women and their hormones?
Sarah, is basically multifactorial. What does that mean? It has a genetic component. It has a component that is ligated to the sex of the individual who's presenting it. For example, in women, it's more prevalent because of estrogens that women produce during their reproductive cycle. And after menopause, when women start taking supplements for hormonal therapy, that also produces a condition that damages the vein wall, it damages the valves of the vein, and it could also potentially produce blood clots in the deep venous system.
You know, you mentioned some of the side effects, that the skin ulcers and some other things, but I didn't have any of that. And it was interesting because you told me some of the symptoms that I was having that really didn't present, that were alarming to me. Can you talk about some of the symptoms a person would have who had venous insufficiency?
Usually there could be like cramping in the legs, heaviness of the legs, itching of the legs, pain in the calf region, pain in the leg region. Sensitivity, you would interpret as numbness of the feet or a shooting sensation in the back portion of the leg. All these are very distinct symptoms that are usually associated to venous valvular insufficiency.
You know, it was so interesting because when I went to see you, and I want my listeners to understand this, I had some of these symptoms, but absolutely did not attribute them to venous insufficiency. For those who know me, they know the story, but I went to see you for a spot on my back that my dermatologist wanted to make sure wasn't a vein or something that was ready to pop on my back. And you said, "While you're here, you want me to just do this check." And so I couldn't have been more shocked that you found these things wrong. But I thought I had just itchy legs, restless legs, cramps. I had all of these symptoms, but never once associated them with this venous insufficiency. Is that common?
Yes, people usually attribute it to doing exercise, long flights, long walks, long car travels, and you should really make an effort to try to have an expert assessment of this, because if you have blood clots and you don't detect them on time, they could move from the legs to the pulmonary arteries, which are arteries that irrigate the lungs, and that could produce a condition that's very dangerous called pulmonary embolism. When that happens, the person could faint, they could have sharp chest pain and lose consciousness. And the general thinking is, okay, he had a heart attack, but no, it's a pulmonary embolism. And the therapy and the treatment for those conditions is totally different from that of a heart attack. So if you don't know what's happening, the golden first 20 minutes, 15 minutes could be very crucial in the outcome.
I don't necessarily expect you to have an answer to this, but I'd love to hear your opinion. Why is it that people think varicose veins are simply a cosmetic issue? How are they not making this connection? Because I didn't have varicose veins, but I know people who do, and I keep telling them to come see you. But I mean, why are people not making this connection? Is there not enough information about it, or what are we missing here?
Generally, there's not available information on this subject. And after we had COVID, COVID is one of the main culprits for damaging the endothelium, which is the lining that you have inside of the vein wall. It gets damaged. It also produces damage of the valves of the vein. And it is very distinctly established to also produce blood clots in the venous system as well as in the arterial system. So that's why people at the beginning of the pandemic, people that were 20, 25, 30 years old, they were having heart attacks without having any prior history of heart disease. And it was due to this condition that COVID produces.
Okay, Dr. G. So, in light of COVID and particularly, I guess, long termers or some of the things that you mentioned with blood clots related to COVID, is there new research? Are there new treatments? Would you expand on that a little more?
As a matter of fact, yes, there is, Sarah, and that's an excellent question. I really appreciate you making it. We've discovered recently that COVID produces a condition called systemic endothelial inflammatory response. And what that means is that the organs, the visceral organs, and all the organs that have lining inside, for example, the lungs, the gastric portion of the stomach, the intestinal wall, all have endothelium, as well as do arteries and veins. So when you hear a person that has long haul COVID, that's a new condition that's been established in which when the person initially had the infection with COVID, which was uneventful, after 3 months, 2 months, 5 months, 6 months, they could be having fogginess of memory. They have difficulty remembering things. And when they do a scan, a CAT scan, that there have been damage to the distal portion of the microvascular circulation of the brain. Why is this? Because they have endothelium. And when you see people that have chronic leg pains in the lower extremities, in the limbs, or in the hands after 4 or 5 months after prior exposure, when you do a study and a scan of the venous system or the arterial system, there has also been established compromise of both of these systems due to the potential that COVID has for producing clots, even gastric problems. So this is something that is, when you have COVID, don't just leave it at that. Have a complete medical checkup and try and assess if any new symptoms that you didn't have prior to the infection can be related to this with a specialist.
I'm going to tack on to this and make a big enough pause, hopefully, that if we're digging into a can of worms, my trusty editors can take it out. You had asked me if I had COVID, and I said no, but I'd had all my vaccines. So is it tied to, I don't want to give, this vaccine ammunition, but are these symptoms also tied to the vaccine or just the active COVID infection?
There have been serious papers that have established that the potential for developing clots after administration of the vaccine has happened. And this is not makeup, this is actual science. It would be very prudent to establish new onset of symptoms after having had exposure to the vaccine to have a complete medical checkup with a specialist, cardiovascular specialist, to assess if there has been any damage to the limbs or to the organs after this exposure.
I think the argument could be made that you're going to experience something with the vaccine or you're going to experience something with the actual COVID disease or the COVID infection itself. So either way, because of the serious risks, whether it's you've been vaccinated or whether you've just had COVID,
That
a
is
checkup
correct.
with a cardiologist.
The aesthetic condition is, people usually say that when they have spider veins, it's something that is not bothering them in the moment, but you have to see it this way. Imagine a tree, and when the branches of the tree are too sparsed out, the same thing is happening to those little spider veins that you see on the skin. The trunk of the tree is usually very enlarged, very damaged, in order for the little spider veins to appear on the skin. So you should always do a very deep assessment of the functioning of the venous system before doing any cosmetic treatment to the spider veins, because you could worsen it.
I am just so fascinated with this whole process. I want you to just take a minute and explain to the listeners. It never made sense to me before you explained it. Why itching? I've got this vein problem, and you're explaining to me, and we'll talk about phlebitis in a second, but you're explaining to me that the blood flow problem was causing the itching. Will you please explain that so the listeners can understand how itching can be this symptom of venous insufficiency?
Course, of course, that the vein wall is very fragile. So when we have venous hypertension, the vein wall gets disrupted easily, and that liberates a pigment that is deposited in the fatty subcutaneous tissue of the skin. And that pigment is called hemosiderin. The hemosiderin by itself produces an itching sensation. Why is this? Because it has iron in it, and iron produces itching. So that's one factor. And another factor is that when you see darkening of the skin, is because the iron is being oxidized in the subcutaneous tissue, in the fatty tissue, and that makes it turn black during time. So that's one component. The other component is that the hemosiderin, when it's getting deposited in the fatty tissue, it produces a hardening of the skin. And that hardening of the skin is called lipodermal sclerosis. And when that happens, that inflammatory reaction kills off the cells that produce sweat on your skin. So they dry up, and the skin turns very dry and very brittle and very itchy.
And these are, I will tell you, again, for anyone who knows me, what got my attention when I came to see you, beyond the shock of finding out that I had some blood clots, was phlebitis. And so if anybody listening does not know what phlebitis is, Google it and you will be relatively surprised and shocked. But phlebitis, basically, if you've seen anyone from the knee down who has purple skin with little ulcers on it, that's like, I guess, end stage. And so when you told me I was right at the beginning, I was like, what do I have to do? I mean, I would have done anything at that point. So will you talk a little bit more about, we think of venous insufficiency, we're talking about, these varicose veins, and people are thinking they're cosmetic, but I hope that they follow the thread of blood clots and phlebitis. And then you talked about skin ulcers and skin discoloration. Will you go into just a little more detail about the phlebitis?
Sure. So phlebitis, Sarah, would be an inflammation of the vein wall, particularly when you touch your ankle, the inner part of your ankle, let's say 2 centimeters above the ankle. That zone, when it's tender and you press it and it hurts, that would be a phlebitis. It usually should not hurt.
And I've just got to interrupt you because I want people to understand, when you did that, we were in your office, you put your thumbs on I thought you had a stone or something. It hurt so bad. And I was astonished. So can people do that at home? Can they check that at home?
It's very simple. Just go 2 centimeters above your ankle, the inner portion of the ankle, and press right where the crease of the tibia is. That the tibia would be the bone. The vein is right next to the bone. So if that hurts, you have a phlebitis. That should not hurt. That would be a very insidious start of the disease before you get end-stage disease. And you can correct it from the beginning.
Well, that's what I want to talk about next. So we've talked about varicose veins and venous insufficiency and phlebitis, and I have been through some treatments for all of it. So will you talk about how a person can expect to be treated, or how they should be treated when this is discovered?
So this is a very complete approach. We try to do a global management of the venous disease, because you're not just treating a vein, you're treating a person. So that also makes the cosmetical portion of the disease be treated, the well-being of the person also be treated, and their quality of life. So when we do treatment, it's trying to assess all of these factors. So first of all, we should do a treatment starting with phlebotonics. Those are medications that are specially designed to produce reduction of the inflammation of the vein wall. There are special treatments that are applied topically, which also help reduce the inflammation of the vein wall. Of course, the types of soaps that you use could also potentially be detrimental or hazardous to the integrity of the skin wall. So you have to factor that in also. And when you finish doing all of these treatments, and especially correcting if there are blood clots, if there are blood clots, that's the first thing you have to assess and first thing you have to treat. So those are special medications that help dissolve the clots, right? So when you're finished, then you could do a treatment to close the valves of the vein permanently as to not to have this happening recurrently. So what therapy are done very frequently, we could also say radiofrequency ablation, which is a procedure in which you do thermal ablation. You introduce a catheter in the saphenous vein and you produce heat, which closes the walls of the vein as to not have any more hypertension in the venous system and have the leg heal properly. And it's ambulatory. It takes about an hour or 10 minutes. And after your procedure, you can go and take a walk in Casco Viejo.
Yeah. So for anyone listening, it's important to know I did have that radio frequency ablation done. And it's outpatient. You should be warned that you'll be wrapped up like a mummy from thigh to ankle. But I did actually go on a tour of the city. The other thing that I want you to talk about just briefly is the impact of compression hose, because now that you've found phlebitis and 2 clots, that's become part of my wardrobe. Thanks so much. But, there's different weights, there's different types. What do compression hose do? And how does somebody who's listening, we don't like people who do self-management. Of course, it'd be nice if people went to the doctor, but if they know something's better than nothing. So how do you know what kind of compression hose to get and what exactly do compression hose do?
Okay, the purpose of the compression hose is actually one of the cornerstones for management of venous disease, both when you have clots or when you don't have clots. So what the hose does is it takes out the excess amount of blood that you might have pooling in your legs and forces it to return back to the heart. And that has a threefold action. 1, reduces the swelling of the leg. 2, reduces the inflammation of the vein wall. 3, it helps improve the quality and the integrity of the skin wall. And 4, it also helps reduce the discoloration that you might have, these little dark patches that might be appearing chronically in the leg. It helps clear it up also because you're reducing the deposit of hemosiderin.
Well, and they're a great fashion statement. all the different colors you can get, right? So I guess some of the final questions that I have is, you posted the most hilarious meme about, you don't ask a woman her age and you don't ask a guy how much money he makes or something, but you never ever ask a vascular surgeon what kind of cream is going to make varicose veins go away. And so everybody wants to sell something, or everybody thinks this new transdermal patch is going to fix your varicose veins, but that's not reality. So will you address that?
Of course, there are a lot of substances that are available commercially. Not all of them are safe in the first place. Not all of them reduce what you're trying to achieve. So when you do these types of therapy, it should be under strict medical supervision, because otherwise it could be compromising liver function, kidney function, and other aspects that are very intricately involved in the recuperation of the vein wall.
So the other thing is with phlebitis, and I'm going to lump them together, but feel free to separate them if necessary. These can't be cured. Venous insufficiency isn't cured, it's just managed. Is that correct?
Okay, let's see it this way. It's like hypertension. It's like diabetes. You don't cure them, you manage them, right? So remember that it has a genetic component that is part of the disease. So when you do treatment to a diseased vein and you close it, if you don't take care of the rest of the veins that are at that moment normal, they could also potentially get damaged if you don't take care of them. So it's like the patient who has high blood pressure. If he doesn't take his high blood pressure pills, they have ECV, a stroke, a heart attack. And the patient that has diabetes, if they don't take care of their blood sugar levels, they usually have compromise of the microvascular circulation and end up with amputations. And in the patient that has venous disease, after they have their treatment, if they don't take care of the veins that have not been diseased, they could end up having venous insufficiency in the ones that were previously healthy.
Yeah, and as much as I enjoy visiting you, I frankly do not want another venous procedure if we can skip that, right? So so in closing, I mean, if you were to, just leave a message with the listeners about what to look for, what to do, is there some hard and fast, maybe some rules or some guidelines that you would give somebody?
I would recommend that if you have swelling of the legs, cramps in the legs, itching of the legs, discoloration of the skin, try and have an assessment with a specialist. And in the meantime, try and have your legs elevated, at least at the level of your hips, not below the level of the hips. That would cause more pooling of the blood. And when you go to bed at night, try and take two pillows beneath the legs to have the blood that might be trapped in the legs return back to the heart while you're sleeping. And when you wake up, the legs would be less swollen.
All right. Well, I appreciate you making time for me today. I know
My pleasure,
I
sir.
had prepped everyone that you might have a little emergency of some kind, but nobody had a heart emergency today. So thank you for joining me. I appreciate it.
My pleasure, Sarah.
Thank you so much.